much, Speaker. My question is to the Premier. Speaker, Amanda Molnar's 20-year-old son is blind and nonverbal and has complex medical needs. He has had serious pneumonia 3 times since June. About a week ago, Amanda had to call an ambulance for him and was told that a backlog at the ER would mean at least a 15-hour wait at the hospital. Does the Premier believe that a 15-hour wait for emergency health care is acceptable?
Minister of Health.
Thank you, Speaker. Does the member opposite believe that some of the innovations that we're doing, like the 911 redirect, is making a difference in their communities?
Absolutely.
You know, in London, Middlesex, I will highlight, they are one of the pilot projects, and in fact, their satisfaction rate is upwards of 84%, and people are not having to go into emergency departments as a result of some of the changes that we are able to make. Working with our community paramedics, working with our emergency department physicians to ensure that there are options other than only and exclusively an emergency department. We're doing that work. I would love for the member opposite to have some conversations with paramedics, with the organizations that are doing these innovative pieces.
Order.
And saying, do you see value in expanding them beyond the current 49 pilots? I see the value. We have made those changes, and we're expanding those programs because we see it making a difference for the lives of patients. Thank you.
Supplementary question.
Speaker, Amanda's satisfaction rate is not high. If her son went to the ER by ambulance, he would be attended by paramedics during the 15-hour wait. But Amanda would not be able to be with him to help him communicate. If Amanda drove him by car to the ER, she could wait with him in his wheelchair. But forcing him to sit up for 15 hours would make it even harder for him to breathe. With no good options, Amanda made the difficult decision not to go to ER. Speaker, does the Premier believe that his government's failure to deal with ER wait times is risking the health of patients like Amanda's son?
Minister of Health.
Thank you, Speaker. You know, I continue to believe that when we encourage the innovation, that when we talk to the patients and the partners on the ground, whether that is community paramedics, primary care physicians, nurses, doctors, hospital CEOs, we come up with solutions that are actually making a difference for individuals like your constituent. We are doing that work. We're expanding the models that are working, and we're ensuring that people get the appropriate care. It can't always and doesn't always need to be a direct route from home to paramedics into emergency department, which has always been the way. So we're not going to keep doing the status quo and expect a different result. We're having this innovation, we're seeing results, and we're continuing to expand it across Ontario. Thank you.